As military families around the world enjoy the Halloween season and all it entails, at least one Army dentist approves. Captain Katherine McCabe of Fort Campbell, Kentucky's Taylor Dental Clinic shares her perspective on Halloween treats.
Go crazy on the candy, but within reason, and then watching what kind of candy you're eating. Mainly stick to the chocolates and not the sugary stuff.
McCabe says solid chocolates, as opposed to gummies, suckers, and chewies, are the least likely to linger on teeth and gums. Hard suckers and jawbreakers can give quite the Halloween trick.
Those have been known to break teeth, so those are not recommended at all. I'd probably keep those away from the kids. I've had patients come in with crowns off so they can remove crowns. The sour gummies, so acidity, it's pretty high with those. Anything acidic is also going to be hurting the teeth. Taffy, that kind of stuff, is also going to get stuck in between the teeth. And then usually a lot of kids, when they're not brushing all the areas of their mouth, so a lot of that candy can get stuck behind the teeth, and then it just sits there and causes cavities. If they can tie their shoes, usually they can brush their teeth. If they don't have the manual dexterity yet, then the parents need to be the one that are brushing the teeth in the morning. For 2 minutes, just a little bitty amount of toothpaste, usually just a smear if your child is 0 to 3 years old, or a pea-size amount 4 to 6, and then you can do regular amounts of toothpaste after 6 years old. And then rinsing using a fluoride rinse. Flossing every single day. Just usually once a day, usually at night is the best, just to make sure none of that food is stuck in between the teeth, because if it's staying in between the teeth and they're sleeping all night long, it's just going to cause the cavities to progress more. If you're going to splurge on the sugar, make sure that you're seeing your dentist twice a year, every 6 months, just to make sure that there's no cavities going on. And then for kids, they should probably be starting to see a dentist around 1 year old.
McCabe says Halloween is a fun time for families, and she does not discourage kids from enjoying treats of the season. But it's important to practice proper dental care so that the only traces of Halloween that remain are the memories and not the tooth decay.